This is Duke University.
Good afternoon. It's also my pleasure on behalf of all of us at Duke Medicine and the International Partnership for Innovative Healthcare Delivery to wish Case well and celebrate 10 years of good work. But I want to move us away from celebrating a little bit to really think about the next challenges. And so I want to challenge everybody in the room to think about how to take the good work of the last 10 years and continue to have impact, and specifically about global health. So this is the state of the world we live in. If you happen to be born in some places in sub-Saharan Africa, you can expect to live less than half as long as someone who's born in Western Europe. These are just the tip of the iceberg in the types of disparities that exist in health. And it's easy to see a map of the world, but these exist in microcosm anywhere in the US. We certainly don't have equity in terms of the way health or even access to healthcare is distributed. And that comes back to a fundamental structural problem that we struggle with in healthcare every day. And it's something many of us call the iron triangle. If you think about what drives health and healthcare, on one side of the axis is access to care. In many parts of the world, including Durham, North Carolina, people struggle to access any health services. When they can access healthcare, the quality is variable and inconsistent across the board in developed as well as developing economies. And finally, every country in the world struggles with the affordability of healthcare from individuals to society, and we see that playing out right here in the US. Add to this iron triangle the fact that non-communicable diseases are creating an intolerable burden in developing economies that are still struggling to deal with the communicable diseases of generations ago. The demographics of the world are shifting that leads to an aging population that's not able to cope with the lack of healthcare services. There's a complete lack of infrastructure in many parts of the world, and even when they exist, the infrastructure isn't adapted to the needs of the population, and we certainly don't have the human capital necessary to drive high quality and affordable health and healthcare. So that's one side of the equation. These are the challenges, but at the same time, to many of you in this room, these are opportunities. What we need are innovative new models of care. We need disruptive technologies that can bring cost-effective solutions to the market, and we need novel programs that can develop the workforce of the future. And these are opportunities for social entrepreneurs. And these are opportunities because social entrepreneurs are change agents, or so this esteemed author, someone Greg Dees, has told us, even before he came to Duke, but we'll still take credit for it. And why are they change agents? Because they care about social value, because they are relentlessly going after new opportunities, because we continuously innovate, because they can act boldly, and they are ones who thrive in a platform of accountability. And these are the types of change agents that we need in health and healthcare, and they are largely emerging from all over the world. So what do they look like? They look like this: Medi-Call Home in Mexico that offers, as a piggy bank to a telecommunications service, the ability to access 24 hours a day physicians and nurses by using your mobile phone. This has provided access to health services to millions of people who didn't have it before. It looks like this: One Family Health in Rwanda. This is a nurse-owned and operated franchise model that provides primary care and access to life-saving medications to populations in semi-urban and rural sub-Saharan Africa that would otherwise have no access to care. It looks like this: LifeSpring Hospital in Hyderabad, India, that's able to offer high-quality institutional delivery services for 1/5 of the price that's available anywhere else in the private sector. And it also looks like this: our own students and faculty here at Duke that have developed something called the Pratt Pouch, a ketchup packet size technology that provides access to life-saving antiretroviral therapy for the newborns of women who know they have HIV. This is preventing the spread of HIV and AIDS and leading to an AIDS-free generation. So if they're out there, then why do we still have these tremendous disparities and problems? It's an issue of scale, and it's something that the good faculty and staff of CASE have worked on for many years. And we know that there are many gaps that inhibit the scale and replications of these models of care. There's a knowledge and networking gap, a business gap, a financing gap, and a regulatory and policy or environmental gap. And we have moved ahead, and as Matt pointed out earlier today, we are launching something called the Social Entrepreneurship Accelerator at Duke to address exactly these issues. This is a $10 million program jointly by USAID through their new Higher Education Solutions Network, and is a program that brings together the best of all that our university has to offer. Get the next slide. So as I said, this is a partnership that's coordinated by the Duke Global Health Institute that is, at its core, a partnership between the Center for the Advancement of Social Entrepreneurship as well as the International Partnership for Innovative Healthcare Delivery, and our partner Investor Circle is quite a key player in this, as well as all of the students and faculty across Duke. So in our program, we are going to start with some of the best innovators, social entrepreneurs from around the world. And we're going to select the cohorts that best have the ability to scale and have impact. And to ensure that we can support the scale of these innovations, we're providing business model innovation support, including corporate mentors, so people from established life sciences, information technology, telecommunications, and related companies that can provide advice, mentorship across the board to these budding innovators. We're developing peer innovators of the best healthcare entrepreneurs around the world that can learn and teach each other. We're going to mobilize private capital and leverage impact investment. And we're going to do that by engaging all of you, faculty and students across Duke University, with a key part being the development and dissemination of knowledge so that we generate policy insights that can help set up the ecosystems that will continue to scale innovation. And finally, we will thrive in accountability, and so we will assess the impact and continue to refine our process. When we're successful, we will have as our outputs scaled impact. So take LifeSpring Hospitals. It's 15 hospitals in Hyderabad. Why shouldn't they be 150 hospitals across India? We will also have the dissemination of knowledge and insights as a core part of our mission. And importantly, this will help us to develop right here at Duke University the next and new generation of social entrepreneurs. And that looks like this. It's our own students spending time in Rwanda learning how to be a social entrepreneur and understanding the challenges on the ground. It's spending time in India understanding what it really means to provide eye care to anybody that needs it. These are the students that are going to make a difference in the lives of many people around the world. And this is going to be the legacy of CASE over the next 10 and even more years. And when we think about these students that will go from here with the learnings that they pick up, will themselves become the new social entrepreneurs, and they will be change agents that improve the world, because they will focus on social value, they will think about new opportunities, they will continue to innovate, they will be bold, and they will be accountable. And finally, when I think about these principles, I can't think of another group that embodies this as much as our own team here at CASE. So congratulations on a job well done, and look forward to working with you on new challenges. Thank you.